Terry Thomas. I'm a family nurse practitioner here at the University Health Center, and we're going to talk about pap smears. Now, the first thing you need to know is that the pap smear is only the test itself for abnormal cells of the very bottom part of your uterus. This is your pap smear. It's not the whole appointment. The appointment itself is called an annual exam or a physical and a pelvic exam, okay? Now what we do is we find out your whole health history, we find out about your sexual history, we find out if you're having any kind of abnormal symptoms, what are your periods like, if you're having problems with your stomach, your breathing, your heart, we screen you for thyroid disease. We do a breast exam. What we do is we have you sit, after we ask you all those questions, we have you sit on an exam table. Now, when you're getting examined, you will have a sheet around your waist and you have like a little cloth poncho over the top because we're going to basically be checking your whole body. So then I start at the neck and I work down. I feel your thyroid, make sure that your lymph nodes are all okay around your chest. Then listen to your heart and your lungs, make sure those are okay. And then I have you lie down, and then I do a breast examination on you. And if you don't know how to do a breast examination, we'll go over that then. From there, I listen to your stomach. We listen to what we call bowel sounds. That's how your stomach gurgles and your intestines gurgle. And then I poke around and just make sure that everything in there is normal and doesn't cause you any pain. We check your lymph nodes in your groin. And then we're going to get you in a position, it's kind of an awkward position, but it's in a position where you're laying on your back, and we have you scooch down to the end of the table, and we have you put your heels in what we call stirrups. I call them heel holders, only because that's what they do. They hold your heels, okay? So you're going to be on an exam table with your heels in here, and we have you relax your legs out. Now, I always say is two things. This is going to be awkward. It's awkward for everybody. I can't take the weird factor out, and either can anybody else who's doing an exam. But if we do this right, it shouldn't be painful at all. And that's what we all worry about when we have these exams. So then once I have you in a position, we're going to have your knees go out to the side, and then we're going to start our exam. Now let me show you first. This is called a speculum. And a speculum, no, the whole thing does not have to go in you. It is not much wider than my finger, and then it's the size and the shape of your vagina. So what we do is we come in to do it, and this is only a light that goes into the end so we can see. So what we do is we go in, very carefully go in and put this in your vagina, and then we turn it. We're looking for the very bottom part of your uterus, and when we find that, we're going to open this up a little bit. Now there's a lot of give here, but you'll feel a little pressure in your insides, but it shouldn't be painful. Once we find out where your uterus is, then what we do is we have a little swab like this. This is an STD test, and we go in and we bring it out. We have another similar swab to take the pap smear. And the pap smear, again, we go in, and the pap smear is then put in this. Again, this is the test that looks for abnormal cells at the bottom part of your uterus called the cervix. Then I close this, and we pull it out. And that part of the exam is done. The second part of the exam is where I'm going to put a finger inside your vagina, and I'm going to be pushing down on your stomach and feeling the size and the shape of your uterus. Then we go on each side to feel for ovaries and tubes. We don't want any, growths in there, any abnormalities at all. And then we're completely done with our exam. So then, usually within a 2-week period of time, you'll have a letter that tells you the results of both your STD testing and your pap smear. And if there's abnormality at all, we'll call you and let you know what that means and if there's any kind of follow-up that's needed whatsoever. And please come with questions. Write them down before you come in, because if you want to ask anything about anything that has to do with your health, whether physical or sexual, this is a great time to ask them. How often should you have a pelvic exam, an annual exam, or a pap smear? Now, the annual and the pelvic should start at age 21. Of course, you can come in any time before then if you're having any kind of pain, abnormal vaginal discharge, pain with urinating, or itching and burning externally. If you have any questions about that, please come in. But the actual annual exam, you should not be on your period. You have it once a year, and that's where we ask you all the questions and do the physical. You will have a pap smear, the test for the abnormal cells, at age 21, and if it's normal, you don't need to have another one of these tests for 3 years. But you still need to continue having the actual physical exam every year. The question is, what do we do? Do we talk about contraception? Do we talk about birth control? Do we talk about sexually transmitted diseases? And yes, we do. We talk about contraception. That can be birth control pills, condoms, IUDs, implanted devices, NuvaRings. Those are the main ones that we talk about. We also can talk about sexually transmitted diseases. So how does it affect you? Why do we test? How do you get it? And how you can prevent yourself from getting it, how you can protect yourself from being infected by these sexually transmitted diseases. How do we talk about your periods, also known as your menses? So we talk about how regular are they? How long do they last? How heavy is your flow? Do you have a lot of pain before, during, or after your period? Or do you have cramps or periods very erratically during the month? So we ask all those questions as well, just to know about how that works, and also it's nice to know that if we're trying to start you on some sort of medication to regulate your periods. If you come in to see a provider here at the University Health Center, and it goes well for you and you feel comfortable with that person, we really encourage you to continue seeing that person, because that helps you just build a sense of trust and you get to know each other very well. So if I saw you for your pap smear or a physical and you feel comfortable with that, we encourage you to keep coming back. You can keep coming back and you can request the same provider every time you come in.